Hiya, my name's Andy. I'm 22 years old and I'm from London in the UK. On the 22nd of August 2011, which is 1 week from now, I'm going to be having heart surgery to repair my tricuspid valve. I've been on a waiting list for this surgery for about a year now. The initial date for the surgery was on the 8th of August, but the day before it got cancelled for an emergency. Little background on myself. I was born in 1989 with 2 holes in my heart. It went undetected for about 3 months, and it wasn't until one of the consultants that we saw said, I'm not gonna. Well, I was actually put on a waiting list for that surgery for a year. But one of the consultants told my parents that I wouldn't last a year. So my surgery took place 1 week from the time that my parents knew that I needed the surgery. My surgeon was Mr. Mark Delaval. He's a French surgeon. And I had that surgery done at Harley Street in London. But the problem was, because it was left for 3 months undetected, it's left me with a slightly enlarged heart and a leaky tricuspid valve. The reason I'm having surgery now, as opposed to like not having it in the past 22 years, is because my leak has gone from moderate to severe. So I've been told that I do need surgery, otherwise I will notice a difference in my quality of life in the next 10 years. I've been told that I'll start noticing I'll struggle to walk up the stairs, I'll struggle to do everyday things, like when I talk, I'll struggle to catch my breath and things like that. Also, if I do leave it, it could cause damage, so much so that I would need a heart valve replacement rather than a repair. And when I get replacement, it could be replaced with another valve, or it could be replaced with a mechanical valve. So I think, like, in my opinion, it's best to get the replacement. To get the repair. In future years, I mean, this surgery will give me 30 years extra, and after that period of time, I might possibly need some more surgery, possibly replacement. I'm not too sure about that. That's far ahead in the future. You know, if you're told you have to have heart surgery and you're told that if you don't have it, then there's repercussions, then, you know, as horrible as it sounds, you know, you have to, you know, I mean, I'm not saying it's like, grow up, come in, it's not like that. It's like you have to mentally prepare, you have to be psychologically okay with it. And, you know, it's hard to comprehend, especially if you're, you know, you feel like you're normal, or maybe you feel like you're okay. You know, it's hard to comprehend, you know, why do I need this surgery? I kept saying to my parents, like, I feel fine, I'm someone who goes to the gym, I'm someone who, you know, likes to be included in every single activity regardless of what it is. So, you know, I thought to myself, why do I have to have it done? But, you know, even if you're like me, you feel quite healthy, or if you're someone who's struggling to walk up the stairs, or, you know, if you're told you have to have it done, I would rather have this done and have my life prolonged. I'd rather have this done and live a more healthier, happier life, you know, better quality of life, than to just, you know, feel bad in the next coming years. You know, just, you know, I feel personally, I feel blessed that, you know, I've been given the opportunity to have these by, you know, these people. As I said, they're angels. They're people who have studied for years and years to perfect the art of heart surgery, and who can make your life better, make your quality of life better. And I just think it's an amazing thing. And, you know, I sort of feel a bit disappointed in myself in a way that at one point I felt that, you know, I shouldn't have the surgery because I don't need it, I'm fine. Where these people have offered, or if you're going private, you've been told, you've been referred, or you've been told you need it. I sometimes at night I lay down and I think, I kind of walk through the situation, where you got the lining in your arm, maybe your hand, I'm not sure where, it depends where you have it, and you lay in there, and I think they tell you to count to 5. Then you're awake, and then you just, wow, it's this beautiful feeling. Sometimes I'd lay in bed and I walk through that, just to mentally prepare for the thing that's going to happen in the future. But I can't wait for it to happen. I'm raring to go. I was scared, and maybe part of me is a little bit scared, but when you're faced with the inevitable in a way, you can't shy away from it. You should flip it the other way around and feel, well, this is the approach I'm adopting, where I just feel so grateful that these people are taking the time to do this for me. I feel absolutely blessed that they're doing it for me. So yeah, this is 1 week before my open heart surgery. If you do have any questions, the questions that you ask I might receive beforehand, in the coming weeks or after. If anybody needs any advice, if you've got into a complete state, if you're really upset and really scared, then please don't hesitate to contact me. I'll be more than happy to answer anything. Okay.